The feds have announced they plan to terminate several Medicare and Medicaid projects that impact primary care, kidney care, and health care payments. The Centers for Medicare and Medicaid Services say they will also drop a planned initiative that would offer certain generic drugs to Medicare enrollees for only $2. The agency says the planned terminations would save nearly $750 million while also impacting millions of patients. We knew some of this was coming because of an executive order signed by President Trump back on his first day in office. He actually rescinded orders signed by President Biden that were developing different experimental drug pricing models and standardizing a $2 flat copay for generic drugs to treat chronic conditions. But 3 of the soon-to-be terminated models were actually designed under the first Trump administration. Only 1 was created under the Biden administration, demonstrating definitely a shift away from past priorities. All projects being terminated were offered through the CMS Innovation Center. That's a special office that launches and tests new ideas in agency programs, including Medicare and Medicaid. The goal is to move outside of typical payments rules and processes. The impacts could be quite big. Experts say to expect pushback from doctors and other healthcare providers that were involved in these projects, as participation in these models involves significant planning and investment. Others warn of the impact to patients in terms of cost and in care delivery, and others are keeping an eye on procedure. Some of these project terminations will actually require a formal proposal and a rule to terminate. You can read more on these projects being terminated. We link to resources in the description below.